Hello, this is What You Need to Know, Coronavirus. It is Monday, the 16th of March. We're talking at about 12:51 p.m. The number of cases in the U.S. has reached 3,602 as of the time we're speaking. Although a global turning point was reached over the weekend, more people have now died of COVID-19 outside of China than in China. We're going to get a read of what's going on here in the U.S. and in Georgia with Andy Miller. He's CEO and editor of Georgia Health News. Andy, how many cases are we looking at in Georgia now?
We now have 121 cases here in the state, which is up from 99 that were recorded on Sunday. And we're kind of seeing like a jump of 30 or 20 cases a day now that we're seeing more testing, diagnostic testing of citizens.
Well, right. The federal government says that now 2 million tests are available in the U.S. for people to be tested. Are there any concrete plans here in Georgia for rolling out either mobile units or fever clinics so that people can get tested?
That's a good question. And I was reading today that the Valdosta Hospital has started a drive-through testing clinic in South Georgia. And also, Phoebe Putney in Southwest Georgia is planning to do the same. But I still think we don't have enough test kits. And the state has talked about establishing testing centers across the state, and they're supposed to roll that out, that plan, this week.
Well, since the number of cases has climbed from fewer than 10 a week ago to now, as you said, 120 or 121, there have been in other states which have been harder hit public bans on gatherings of people of over more than 50, restaurants and bars in some places, and stores have closed. Any sign of those restrictions coming for Georgia?
Well, we haven't seen them yet. It's still possible. I mean, the governor has declared a public health emergency, which gives him more powers to create bans like that. But basically, he's let the school systems decide whether to stay open or not, and businesses as well. I think that in the coming days, we could see stronger action and more requirements from the state of businesses.
How about hospitals? There have been reports, certainly from Italy, Iran, other places, of hospitals and healthcare systems being overwhelmed. Here in Georgia, we have big metropolitan centers, and then we have small rural counties, some of them without any hospitals at all. Where is the state looking at readiness for Georgia now?
Well, I think that all the hospitals have gone through emergency preparation plans. They're talking about this actively. And you see that some of the bigger systems like Emory are postponing elective surgeries, so that therefore they can get their staff and their equipment, enough equipment involved for an influx of these patients, these COVID-19 patients. But I'm also hearing from medical providers, hospitals, and doctors that there's not enough protective equipment for them. That equipment is scarce. They're having trouble ordering it. And you need a lot of it to combat an infection like this. So that's a real worry for hospital administrators and for staff, because we don't want to get doctors and nurses and technicians at hospitals sick and take them out of the system.
So I know you're not a doctor, but there has been some confusion about people here in Georgia and all over the United States of what they should do if they think that, one, they may have been exposed or may have some symptoms. What are the recommendations from state health officials now?
Well, one recommendation is if somebody is kind of worried about this or may have some mild symptoms, is not to go to an ER, but to call state officials, call their local medical provider, and get guidance from them. It's the people that are seeing real spikes in temperature and respiratory systems. Those are the people that we really need to be treating on the front line. And so the recommendation for those people is doing the same, but they will probably be seen quicker than someone with pretty mild symptoms.
Annie, what are you watching now as this week goes forward? So many people hunkering down in their homes, new cases coming up every day. What are you looking out for?
Well, I'm looking for, everybody expects to see a lot more cases, and I think that's going to happen as testing ramps up in the state. And I think that we're going to see a real burden on healthcare providers, whether it's a hospital or a small doctor's office, perhaps. So we're waiting to see what the real numbers are. We really don't have much of a clue as to how much COVID-19 is out there in our communities. And so, but what the government is doing, what Governor Kemp is doing, what businesses are doing, are telling us that they're getting ready for something that's going to be a really big impact on our state.
Andy Miller, he is CEO and editor of Georgia Health News. Thanks so much for your time.
Thank you, Virginia.
And stay safe.
Thank you.